Are you struggling with knee pain? Trust me, you're not alone. There are so many other people that struggle with knee pain on a daily basis. And as we get older, it's only more and more likely to happen. So some of the things that people really, I see on a daily basis when I'm working with people with knee pain, they focus on the diagnosis. I have bursitis, I have patellofemoral knee pain syndrome, I have osteoarthritis, right? My knee is degenerating. I'll never be able to walk again. These are things that even surgeons that do surgery on people's knees tell people. And this is a gripe of mine because oftentimes I see people that are told that they need to have surgery or an injection or something like that. We address a couple of things in personal training or physical therapy, and these people are feeling much, much better. So if you are interested in kind of knowing what's going on with maybe your knee, how you would treat it, go ahead and check the description below. I'll have a link down there to a guide that I made, Freedom for Knee Pain, and it will help walk you through what might be going on with your knee and how we go ahead and treat it. So let's talk about knee pain, right? There's so many fixes out there. Most of the time people are talking about the quick fixes. The quick fixes being compression, ice, elevation, knee brace, maybe an injection, right? Maybe even surgery. These are things that people want. Most people just want quick fixes. However, you notice that most of these things, like say you put a knee brace on or ice or an injection even, they don't last. They just keep coming back. People then get upset. Why is my knee pain still here? Well, it's because you never really treated the cause of why you might have knee pain. So because you have arthritis, that also doesn't mean that you have knee pain. Your pain might be just related to having tight muscles, maybe even tight hips or weak hips. And really, honestly, as a physical therapist, personal trainer, I see people with this all the time. Most of the common reasons why people have pain is because their hips are weak. Their glute medius, which is the muscle on the side of our hip, as well as our glute maximus, which is the big butt muscle, those are weak. And so particularly for the people that I work with on a daily basis, hikers, backpackers, trail runners, we're typically going to have tight hip flexors and weak glutes, weak glute medius, weak glute maximus. And what this does is it causes abnormal strain on our knees, particularly when we're changing terrain, whether it's unlevel side to side or whether you're descending. You're most likely going to have some sort of pain because the muscles that are supporting you, those glutes around the hips, are actually causing things to happen below it. So that's why hip weakness is one of the main things that we as people struggle with. Most people, whether you train it or not, you're going to have weak glute medius, and that's because we don't use it on a daily basis. Those muscles are the ones that make us go left to right, so maybe like sidestepping or that sort of thing. Most of the time, as human beings, we're moving in a straight direction. We're not going side to side, only a little bit. So those muscles aren't really used a lot, and they're not trained for that. So when we do these long distance hikes, for example, say we're loaded up even more, like say we're doing a backpack trip and we have 30 pounds, those muscles of our hips are not used to standing on one leg and then supporting us to move forward. So I want you to use this video. We're going to be giving you some quick tips on how to reduce your pain just by even modifying some of the aspects with your hiking. But let's also talk about some of the more long-term fixes. I'll give you some exercises. All right, you guys. Now we're getting in the nitty-gritty. This is what's really going to help you reduce your knee pain when you're on the trail or even just everyday life. If you are having pain and you don't hike or backpack or trail run, try this out. This is the way that I would treat anybody with knee pain, okay? So, most of the time when we have knee pain, we have it in a couple different spots. You can either have it the whole thing, which is usually your arthritis. You could have it on the inside. This is typically going to be maybe patellofemoral pain syndrome. There's a couple different other things that can be there, but patellofemoral pain syndrome, IT band, syndrome is going to be on this side, the outside, and then you can have kind of like your jumper's knee or your patellar tendonitis on the bottom. Okay? But like I said in the beginning of the video, diagnosis doesn't really mean anything, because to be honest, we treat this pretty much the same for all of them. There are a couple little tweaks in there, here and there, but most of the time, as a physical therapist, we treat ankle up to the hip, because both of those sides are actually affecting the knee joint. So what we're going to start with first is a quick test to see, do you have strength in the hip? So there's a couple ways to do this. What you're going to do is you're actually just going to go ahead and lay down. And what I would recommend that you do is you actually want to lay against the wall, because what it's going to do is it's going to help you from cheating. So in this case here, I'll just lean up against this couch here and pretend it's a wall. What you then are going to do, you're going to stack your feet one on top of the other, and then you are going to lift up and down, okay? So there is a little more tweaks to that to make it work even harder. So what you might find if you're weak is you're going to roll side to side with your hips when you do this. That is a compensation. That's a cheating method, so do not do that. You just want to lift straight up and down. The other thing we'll notice is when you lift up, most people will kick straight. They will not, or even, they'll kick it up, but then when they get up, they kind of kick it up this way. They kick it forward. So what you want to do, you want to lay on your side, stack your hips. You're going to go straight up. You're going to actually take your foot and you're going to point it down and kick it up there. Hold it for a little bit. 1, 2, down. So we're going to kick it up. 1, 2, down. And what you should feel is in your hip, right on the side, and it's actually kind of a divot in your hip. Right there, that's where you should feel that muscle work. You should feel a contraction and down. Some people might not even be able to lift this up, and that is probably why you're having some pain. So working on this is a really good thing for you to do. And now, even if you don't have knee pain, this is a really good thing to do as a prevention exercise. Okay? So ways to tell if your hip is weak. 1, you're not able to lift it up. 2, you compensate a lot. Either you go forward, you go backwards, you're rolling your hips around. That means that you're probably weak. 3, you lifting it up and you're holding it a bit and you come down. And I maybe have done, 6 of them, and I'm feeling it a little bit. But if you're really feeling it, then that means that your hip is most likely weak and it's something to work on. So what do? Well, you treat it just like you test it. So you do the same thing. You lay up against the wall, you lay on your side, and you lift it up. And you do that until you're tired, until you're not able to lift it up anymore. Generally, we start somewhere around 10 repetitions, but that's just a guideline. So you just do what you need to do in order for you to feel a nice, burn in there, a good burn. It should not be painful. And then you take a break and maybe do another set in a couple minutes or, 30 seconds to a minute. You try it again and you do 2 or 3 sets of that and then you're done. It's just like any other exercise. The more you do it, the stronger it's going to be and the better you're going to feel on the trail. Because oftentimes what happens is people on the trail will be going on the trail, they feel great for maybe 2-3 miles, and then, oh my gosh, everything's hurting, my foot, my knee, my hips. Well, why is that? Well, it's because you're starting to fatigue, usually at the hips, and then things start to change. Everything below it changes. It's like a house or something, right? Like if you change the foundation, the whole thing shifts, and that's what's happening. With these muscles, they hold up our hips. So if I'm stepping and this muscle is weak, it kicks out to the side, right? So this muscle needs to be strong so that when I stand up on one leg, it actually pushes down and this one lifts up. If it's weak, if this side's weak, it gives out. So, and that is why we have knee pain. See, when we do that, it changes everything at my knee. Now I'm almost look bow-legged, right, when I do that. So that is why our hip weakness is going to most oftentimes cause knee pain. All right, you guys, I hope that really answered some of your questions on why you might be having knee pain and how you get rid of it. And I know I only gave you one exercise to do, but honestly, this is one of the most important exercises that you can do, especially as a hiker or a backpacker. And that's why in almost every one of my videos, I'm talking about glute strength and specifically glute medius strength because it affects so many things when you're hiking. And when you are hiking, you have a big heavy pack on, and so it is going to be even more crucial that you have strong hips. So please comment below if I missed something, if you want me to talk about something more in specific. Like the video if you liked it. Please share the video. It helps out the channel tremendously. And subscribe. That also helps out tremendously. Maybe even hit that notification bell. And I'll see you on the next one. Thank you so much, guys.